All right, we're back. Let me erase a couple things here. All right, so we're back. So let's interpret this ABG. We're looking at the pH. The pH is 7.55. So if we look on here, 7.55 is high, which means that this is alkalotic. So we already have the answer to the second portion of our question, alkalosis. So now let's look at the CO2. The CO2 is 33, which is low, and a low CO2 represents alkalosis as well. Now we're going to look at the HCO3, or the bicarb. That is normal. So your pH is alkalotic, and we know that the CO2 is low, leading to an alkalotic environment, so that should give us respiratory alkalosis. So let's look at the notes and see what we've got. Respiratory alkalosis, right there. All right, our pH of 7.50, that is high. Oops, let me get my thing here, that is high, which means alkalosis. Our CO2 is normal, and our HCO3 is high, which is alkalotic. So here's where the ME portion comes in. Rome, metabolic, or let's see, respiratory opposite, metabolic equal. You can see that these arrows are going in the same direction, right? So this is metabolic alkalosis. So let's look at the notes and see if we're right. And we're right. All right, so our pH is 7.36. Where does that fall? That is normal. Our CO2 is 40, which is also normal. And our bicarb is 26, which is also normal. So this is a normal ABG. So this patient's going to be discharged and going home. All right, so now we're going to move on, and we're going to try to do some of these without our little cheat sheet next to us. All right, so your pH is 7.32. Is that high or low? That's low, and we know that that is acidic. All right, so we'll come down here and get the second portion of our question, acidic or acidosis. So how about our CO2? Should be 35 to 45, and that is 34. So that is 34 is low, and that's going to be more on the alkalytic side. And then our bicarb is also low. That should be 22 to 26. All right, so bicarb is a base. So when it's high, it's alkalytic, but when it's low, it's going to lead more to an acidic type environment because it's not going to be buffering appropriately if it's not there. So what do we think this ABG is? We know the pH is acidosis, so it looks to me like metabolic acidosis. So let's check and see. So a metabolic acidosis, and the answer here says that it's compensating. So why do we think that this is compensating? It's compensating because we can see that the body is trying to lower the CO2. It's trying to lower that CO2 in order to help normalize this pH level. Okay, so your pH is 7.58. Is that acidotic or alkalotic? That's high, so it's alkalotic. And your CO2 is 30, which is low. That's also alkalotic. And then your bicarb is 23, which is normal. So this should be respiratory alkalosis. respiratory alkalosis. I guess I had the answer up there and didn't realize it. So, all right, pH of 7.48, that is high. So that's also alkalotic. Your CO2 is 48, which is high, so that's acidotic. All right, but we already know the second portion here is alkalosis, and then your bicarb is 36, which is high. So that's alkalotic. So that should be the culprit right there. So that should be metabolic alkalosis. Metabolic alkalosis. All right, so your pH is 7.36. Where is that? That is normal. And your CO2 is 58, which is high, so that is acidic. Your bicarb is 37. That's also high, but that's alkalotic. Okay, so what's happening here with this ABG? We have a normalized pH. Well, this is what your body always works to try to accomplish, is normalizing that pH, because otherwise your cells and your organs can't function properly, right? So this is what compensated looks like. This is still an abnormal ABG. So what is happening here? If we take and we look at the normals, 7.35 to 7.45, and we know that this way is acid and this way is alk, where does this 7.36 kind of fall? It's normal, but it's barely normal, and it's more on the acidic side. So we're going to look and see which one of these is acidic. Well, 58, 45 is the high end of normal, and this is 58. And we know that an elevated bicarb is not going to cause acidosis. So that only leaves us with one possibility. So this has to be respiratory acidosis, but it is compensated. And it's compensated because this pH is now normal. So let's take a look at the answers. So it's compensated. All right, so we just want to go back real quick before I end the video and just talk a little bit one more time about the different types of patients. So if you have a patient that you come in the morning and they are, say you're in the ICU and the patient's on the ventilator, the ABG showed some respiratory acidosis. So the RT had to come in and try to adjust the patient's respiratory rate in order to fix that. So say the respiratory rate had been set at maybe 8, and the patient was holding on to too much CO2. So the RT came in and ended up increasing the respirations on the mechanical ventilator up to, say, 18. Now, about an hour later, you're going to go back and recheck that ABG to see what your work has shown, and make sure that we're helping the patient and not harming the patient. So we have to check and see. So we've done a repeat ABG, and now we see that the patient has gone over into respiratory alkalosis. So we basically overshot our goal. That's pretty much what happened. And you'll see this a lot in the hospital. You're trying to help, but sometimes your goal gets overshot. And it's no different than giving someone 50 milligrams of metoprolol, and then all of a sudden their blood pressure is too low. This is the life of nursing, where we have to try to find that happy medium. But respiratory acidosis, the one big thing, and you'll still see this out on the floor even if the patient is not ventilated, and this comes from the use of pain medication. So this is why, if you want to know why we have to record a RASS, the sedation scale, every time we give pain, it's because of in the past we've given patients too much pain medicine, and they've gone into respiratory distress, which leads to respiratory acidosis, and sometimes the patients don't survive that. So that's why it's really important that we chart the RASS along with the pain whenever we're giving someone morphine or Vicodin or any kind of an opiate. So I think that's the end. Hope this helps. Thank you.